Next, I would like to talk about the basal ganglia, the ones that are seen within the brain. So we talked about spinal cord and how we said the spinal consists of gray matter and white matter, and gray matter was collection of soma and white matter collection of axons. Well, the brain also has gray matter and white matter. So this here is the brain seen. So this is the top view, like this. So this is the brain. We cut it, and then we look down on this surface. The left hemisphere here was cut at a higher level, and the right hemisphere was cut at a lower level. Nonetheless, the gray and white matter can clearly be seen in two areas. The gray matter, I mean. The white matter is all of this area here, so you can see all that white matter. The gray matter is found in two places. One is the cortex, right on the surface of the brain, the one we see when we look at the brain. So for example, here, the surface of the brain, this is the gray matter, the cortex of the brain, the surface. Okay, so that's all of this area here you see darkened, and then it was not darkened here, so you can imagine all of this being darkened. That's the cortex. So this is the gray matter, and another place where there's gray matter in the brain is the basal ganglia, which include the thalamus, the lentiform nucleus, and the putamen and the caudate. And the lentiform, we said, consists of the globus pallidus and putamen. So basal ganglia means at the base, which means that this is the gray matter within the base of the brain, within the core of the brain. Okay, so lentiform nucleus, caudate, and thalamus. Now, looking at the structure, this is a transverse section of the brain, which we said like here. When you make a cutting like this, usually you see things like this in an MRI or an X-ray. Yes, an MRI. And what they do is they will scan your brain at different levels, and eventually you come to this level and you will notice the basal ganglia. So here is a very simplified diagram. So here is your basal ganglia, and this dark space here is the ventricles. So we talked already about the ventricles, and there's the cortex. This is also the gray matter, and there's the portion of cerebellum, and there's the corpus callosum. First look at the ventricles. So this is the lateral ventricles, there's the septum pellucidum, and then the third ventricle between the two thalamus, and then this is also the lateral ventricle. Remember the lateral ventricle shape, so that it's like resembles something like this: anterior horn, posterior horn, inferior horn. Well, imagine when you cut, the way you cut this brain, the ventricles also gets cut, so that you end up having a portion of it here, visible here, the anterior horn, and then according to this is actually not the posterior horn, but this is this area here. So we have two areas you can only see: this portion, the anterior horn, and where the inferior horn begins. So here's the anterior horn, and this is the inferior horn, not the posterior horn. So looking at to know which one is in the thalamus, well, immediately this is the thalamus. And how do you know is that this is the third ventricle, and on the two sides of the third ventricle is the thalamus. Then lateral to the thalamus is the lentiform nucleus. It's usually depicted as a triangular shape, okay, the way the two are positioned, the globus pallidus and putamen. And superior to the anterior to the thalamus is the caudate nucleus, and right medial to the caudate nucleus are the lateral ventricles. Okay, so you have thalamus, caudate, and lentiform nucleus. And the way the structure of thalamus is just spherical in shape. Okay, so if you cut it like this, the way we have cut the brain, you should be able to see the entire length of it, which is here. So this is looking at the thalamus from the top, seeing this surface here. The lentiform nucleus is triangular in shape. So if you cut it, you will see the surface when you look from the top. If you make a cutting deeper, say here, you'll note that you will find that the lentiform nucleus will suddenly appear larger, and that is simply because as we go layers down and down and down, like going down, so we make a cutting here and then that more lower and lower and lower, the base of the triangle expands, right? That's the way a triangle is shaped. So we are expected to see that the lentiform nucleus increases in size. And finally, the caudate nucleus is shaped somewhat like this. Okay, so that if you, the way where we have cut it, we should be able to actually see two things more here. This is portion of the caudate tail, like this. See, because of the way we cut it here at this level, we'll be able to see a surface here, and looking here we see a small surface of the tail. So we should be able, and that is here. Do you understand what I'm saying? So this is this head of the caudate, and then the tail, we can just see the tip of it here. So this would normally come out of the page and go back down. Same for the corpus callosum. We do not see all of it because it comes up and then goes down. So the corpus callosum shaped like so, connecting the two brains. Okay, so if we have made a cutting like this, we'll be able to just see here. Usually we should also be able to see the posterior portion as well. So we can expect that there should be an area here that also has the posterior portion of the corpus callosum.